the most comfortable procedure for you if you fall is to call the 911 and say, this is not an emergency. You wouldn't do it, but Bob would do it. And the reason being is because we don't want both of you to get hurt. So then the paramedics would come out and they would help you up, put you back to bed, whatever you need. If your heart stopped then and there was no orange form, then they would try to resuscitate you. So it's a personal preference. Some people say, yes, I want you to do everything and bring me back. And some people say, no, once I'm gone, I just want it to be a natural process.
Right, because, see, I'm at the point now, and I see my oncologist tomorrow.
Mm-hmm.
But I don't know, because I haven't talked to them since all this has taken place. And I would like to know if they themselves have any other options in mind for me, or if not. Like I said, I've taken myself off of the Hospice, so I will not be going back on that. I don't know, you know, this could come back, this, fluid. I will not have that redone.
Okay.
And so I'm kind of in a rock between a hard place and a rock. Where the Lovenox, I'm dealing with that. And what do you call
Medication, all your medication, you have a lot
it?
of
You know,
medication.
it all kind of,
So it sounds like you want to explore what the alternative options are right now. And, I think that's a good idea. A person needs to know they've done everything that they possibly can do. So why don't we will leave, at this point, you are what's considered a full code, which means that the paramedics, they would come out and they would attempt resuscitation. And they would do whatever was necessary. Then at some point you may decide to change your mind. And if you do, what you do is, I'm going to have Julia to sign that she's explained this to you as your health care provider. And then we'll keep that in your hospice chart. And that way, you change your mind, then I come out. And I will witness your signature on that, just whatever, because I don't want you to feel like that you're rushed to make a decision. And then I have another form along those same lines that says that you would want to attempt the resuscitation. And then there's a couple more choices on that, and that is whether or not you'd want to go back to the hospital or not. Some people say, I have never want to see another hospital again. And some people say, yes, you take me to that hospital and you just do whatever you need to do.
yeah, I mean, you want to go to the hospital because you think it's going to be a comfort. They're gonna help me. So I guess that's your first thought, is even leaving the hospital, it's a little scary to come home, because you're going to think,
am I going to be able to make it on my own at home? Yes.
Yeah.
And we do have, let's say that something's going on, we do have, that you had some symptoms that were not manageable at home. We have what's called inpatient units that are short-term. Person goes there, gets stabilized, and comes back home once those symptoms are managed. If you said no hospitalization, it would not be in effect if you were having a heart attack and your lungs stopped working. They would take you to the hospital, because they're not going to read this one. I'm just going to put it in our records. So that's where we're at there. So are you saying that you want to go to the hospital or not?
That's a hard choice, because it's hard to know how you're going to feel at the time that you make that decision.
Well, we can also put one hospitalization with discussion. We could do that. Lots of people do that.
Yeah.
This gives you an option to always say, let's discuss what's going on right now. What's going to happen if I go to the hospital? do I want to go or not, and you can talk with your whole family. We can give you different options that we see, and then you make a decision at that
Yeah.
time. It's not a definite decision I want or I don't want.
So I put it into our medical record, and then if it's after hours, because we have services 24/7. So if something comes up in the middle of the night, I don't want you sitting waiting till 8 o'clock in the morning. I want you to call. So, and this will be in the record for them. And along with that, some people say, I've had enough pills, I don't want any more. I don't want any more antibiotic treatment, and some people say, yeah, I want some antibiotics. So with that, would you, with your history, I wonder if you wouldn't want the antibiotics yet, or not?
I'm not ready to give up things. I mean,
Sure.
the thing is, I'm trying to see,
Right.
once I hopefully get myself back on track a little bit,
Mm-hmm.
and not having this Tarceva, if I don't have any other treatment like that, no radiation,
Mm-hmm.
Mm-hmm.
and just kind of live my life, see what happens, and that's
from there.
kind of where I'm.
So what I understand from you is pretty much thinking no more Tarceva, no more very high neurontic dose, maybe no radiation and chemo. Maybe now I can stabilize a little bit and just enjoy life the way I am right now, and I think that's
Right.
okay. All right.
I mean, there
And
has
so-
been a good improvement.
Okay. Yeah.
As you can see. So this is what we expect out of her.
Okay.
She's gonna fully recover, and she's gonna be almost cancer-free, because now it seems as though, according to Dr. Ashman, which is the radiation oncologist, that it completely shrunk the tumor that was in there.
Mm-hmm.
It's just this one that is stabilized that we're not sure about. Now, so far I've been lucky. The only place it's gone is from here to here.
Mm-hmm.
It hasn't gotten in my liver, my bones, my
Mm-hmm.
head.
Okay.
Now, one question that I had, and then we'll come back to this. When did you say you're going to see your oncologist?
That way.
Wow.
Tomorrow.
Tomorrow, you're going
Tomorrow.
to tomorrow. Okay. The way the insurance, the insurance drives how you manage all your medical. And so the way they do that, are we being photographed?
Yeah.
All right.
Say
Yay,
hi,
hospice is here.
Okay, so the way we, Medicare is the driving force, really. And other insurances, they follow suit. So if you have hospice care, that's comfort care. And so the aggressive treatments, seeing the doctors for the cancer are no longer covered. So what I'm going to do is I'm going to send a message to my team leader and ask her how we would handle that. If you went back on treatments, what we would more than likely have to do is discharge off of the regular hospice. We do have a program that's called our palliative home care. It's not available Medicare service, so we're pretty well, it's actually a social worker that would come and check on you, see how you're doing. That if things were going great, and that would be wonderful. But if by some chance it didn't work out and you needed to come back on, that person, the social worker, then could help you to make sure you get back on right away.
So
and
I
it's
get
still-
back on the Medicare through
You're on
mail.
right. You're on Medicare now when you're on hospice. Is primary. Do you have an HMO?
We have supplement,
Blue
Okay.
Cross
Blue
Blue
Cross
Shield.
and Blue Shield.
Okay. So right now, Medicare is your primary, and they are covering the hospice benefit. That's why I said they only do one or the other.
One or the other what?
Medicare does not cover at the same time hospice care, which is comfort
For the
care,
lung cancer.
or hospital, which is aggressive treatment considered. Medicare pretty much says you have to really tell me clearly, is it comfort care or is it aggressive treatment? So in other words, what Florence was saying, if let's say tomorrow you go to the oncologist and he says, I think you need to have more chemo. I'll give you an example. I don't know what he or she is going to say, but let's say this is the scenario tomorrow. Then you would probably have to come off hospice services, which is comfort care, go have the chemo, have the aggressive treatment, and then in time, if you feel you need to come back on hospice, then we can always come back in the picture.
Because otherwise you're gonna get a bill.
Yeah.
From the
The
Mayo
oncologist
Clinic
and
all
yes,
that.
from the chemo.
So, and that could be astronomical.
No.
So basically, Mom, what it is that you would go back to doing what you were doing before because
Well,
you're not
pretty much.
eligible for hospice if you're doing treatments.
Right.
Right.
We'll pretty much have to step back in order
Then
for Medicare to
I
cover
would
your.
get a bill from Mayo.
Yes,
Right.
Mayo will deal with Medicare about their billing and all that, and we'll step back until you are done with your aggressive
And
treatments.
so, we also don't do any kind of diagnostic procedures or anything like that. What the hospice does, they treat the symptoms. When you say you're having pain, then that's what they're gonna be treating. If you say you're nauseated and vomiting, they're gonna treat that. It doesn't necessarily mean that they're gonna need to know what's the originating cause here, or how extensive.
So
They're
it
just gonna
wouldn't
make you
change
comfortable.
the insurance thing at that
Mm-mm.
point on that.
No, so, because we just do comfort care, and we're really good at that. But we're not allowed to do the, diagnostic treatment, or the procedures to see what size the tumor is, where it's at, if it's come back, they don't do that. So, but I will send my boss a message to see about your appointment for tomorrow, see how that's working. So if you did, let's say, go to your appointment and they say, you know what, we have this other treatment that looks pretty promising here, do you wanna try it? And you think, yeah, I'll do that. Then you'll get a hold of me and I will bring out the forms for, coming off of the hospice, so that you're not gonna get a bill. And, also, if you wanted to be signed up for our palliative home care program, I go through the paperwork for you to be admitted to that. And so that would be a social worker that would be available. And they do have, like you can still call up 24/7, have questions or something like that. They can provide, it's an educational kind of component. Well, this is what's going on. They don't do the hands-on nursing care that the hospice does.
Yeah, well, it gets a little complicated.
It does, but that's why you have me. So when you don't,
And she's very good at explaining how things go.
lots of people, I leave and then they'll call me and they'll say, now what was it that you were saying on that? And so then we'll go over it again, so that's okay.
Right. I mean, the bottom line is that tomorrow they may say, yeah, we think there might be another treatment that might or might not work. They could say too that your body just can't handle any more chemo. Dr. Ashman already said the radiation you couldn't do that. So that's going to be important. If they say that you can or can't or there's nothing left, you could go back on hospice. If there is an option, you have the option to say, yes, I do want to do that. However, if you do that, you're not eligible for hospice care.
Right. But if I felt I wanted to wait a little on the new chemo, I could and continue on this until I made a decision.
Right. And of course, the doctors would tell you whether or not you could wait.
The only thing is, if you're going to the doctors, right now you have our medical director as your following attending, and she will come out and do a visit. Otherwise, Julia is the eyes and ears for whoever's you're following attending. That's your choice too. If you're going to be going to the doctor a lot or something, you might want to check and see if they want to be your following attending, because then the insurance will cover that
visits.
doctor.
Mhm.
I'm not sure if the male doctors, they're kind of iffy with Medicare. So, I'm not sure how they do that. But we can always try that. And then I think there's a copay for like 20% or something, but your supplemental should take care of that. So, now I'm sending
Yeah, with the insurance, it just gets
it does, they
real
really,
touchy and,
And that's where we wanna be very
yeah,
careful and
and that's
follow
what you
your
wanna make
wishes.
sure is right.
Yes, we wanna know what you want, what your plan is, so we will follow your wishes, because we don't wanna come here and say, yes, we'll take over, but then you'll feel restricted in your
Right.
choices. So we wanna make sure that whatever you choose, we will help you in that process. And if we need to get out of the picture for a while because you have some aggressive treatment options that you would like to pursue, then that's what we would do.
Yeah, that sounds good.
Not an easy choice, obviously.
Well, it's never easy to choose because you don't know what happens tomorrow, so you can't really
See,
think
now,
of all.
the thing is tomorrow, I'm gonna be seeing my PA. My oncologist won't be there tomorrow.
you know, but when they bill for
The main doctor.
oncologist. Because the oncologist has to oversee everything.
But I'm thinking what we're needing, and what I was hoping is that they could call Dr. Ross and say, here's what's going on. We need to know, are there options?
Yeah,
If so, what
when
are
she
they?
has- because I don't know when she's coming back.
And that might be an option too. I've just sent my boss and asked her about the appointment tomorrow. You might be able to just call them and
Well,
ask
I
them.
spoke to Dr. Ross's nurse,
Mhm.
on Monday. And she and I discussed what was happening, and so she has alerted Dr. Ross to specifically what is going on as of Monday. Her being
Okay.
in the hospital and the whole thing.
Mhm.
So I'm sure tomorrow when we see Lindsay, which is her assistant,
Okay.
it might be that Dr. Ross would show up at this
Okay.
point.
Could be.
I would think so.
Well, I'm thinking that because we called to
They
see
should
if
be
we
able to
needed
get
their
a hold of
permission.
Dr.